I, Roshni John, am one of the registered dietitians at the Humber River Hospital's bariatric program. It's my privilege to guide you through this class today. Today, we're going to learn about eating techniques after bariatric surgery. Bariatric surgery reduces the amount of food you can eat at one time. Following the recommendations for eating techniques and moist cooking techniques will help you tolerate food better, prevent nausea, vomiting, or malnutrition. It may also prevent any damage to your gastric pouch. Eat 3 well-balanced and well-spaced meals a day with 1 to 2 snacks. Eating less than 3 meals a day will lead to difficulty meeting your nutritional needs. Never skip meals. Your new pouch is about the size of an egg. After surgery, it can hold about half to 3/4 of a cup of food, depending on the consistency of the food. Ensure that you eat your first meal within 90 minutes of waking up. Space your meals 4 to 6 hours apart, and add a small snack between meals containing at least an ounce of protein. Aim for 1 to 2 ounces of protein and a 1/4 cup of starch or carbohydrate at breakfast. At lunch and supper, aim for 3 ounces of moist cooked protein-rich food with a 1/4 to 1/2 cup of non-starchy vegetables and a 1/4 cup of starch or carbohydrate. If you find it hard to meet the recommended amounts of protein solely through food, then take protein supplements. The pouch naturally stretches, so you may be able to increase the amount of food that you eat at a meal. However, remember to weigh your food to prevent overeating and vomiting. Your sense of taste and smell alters after surgery. Foods you loved before surgery may not taste right, and you may begin to like the foods you didn't in the past. So, keep an open mind and try new foods. Your sense of smell also gets acute after surgery. Lack of appetite is normal after surgery. You may notice a lack of appetite for 12 to 18 months following your surgery. This means that you must eat even when you don't feel hungry. Set a clock, timer, or a cell phone reminder, or a computer pop-up to remind you to eat. Make sure to be mindful at meal times. Sit down at a table when you eat and avoid distractions like the TV, computer, or driving. Focus on food while eating. Try eating meals on a salad plate for the less is more appearance. Begin by cutting food into pea-sized pieces and use a baby fork to get smaller bites in. Chew every bite of food about 20 to 25 times to ensure that the food chewed is chewed to a mushy or paste-like consistency. This will help moisten the food and start the digestive process. It will also ensure that the food passes through the opening to your intestine without causing nausea, vomiting, and blockage of the pouch. Try putting your fork down in between bites to help pace yourself at the meal. It is strongly recommended that each meal takes 60 minutes. Try only one new food at each meal so that you can learn about your body's tolerance to food. If a food causes discomfort, avoid it for a few days and then try it again in the moist cooked form or with different food combinations or at different meal times. As time passes, you may be able to tolerate a variety of other foods better. Food textures that are not well tolerated include dry, tough, sticky, or stringy foods. Foods and liquids that commonly cause discomfort include bread, pasta, rice, meat, raw vegetables, and milk. You may have lactose intolerance if consuming milk and dairy products causes you to bloat or have gas, cramping, or diarrhea. In case you've developed lactose intolerance after surgery, choose lactose-free milk and milk products instead. Make it a practice to measure your food and fluid portions using a food scale or measuring cups. Weigh protein-rich foods and carbohydrates or starches after they are cooked. Stop eating when you're full. This may be easier said than done. People may have different perceptions about what fullness could feel like. If you've had too much to eat, you may feel nauseous or pressure or fullness in the area just below your rib cage, or discomfort in your throat. If you feel any of the above, you should stop eating, even if you've not finished your meal. Try to eat again later. We know that it takes about 15 to 20 minutes for your brain to recognize fullness. So, eating quickly can cause you to overeat. It is recommended that you take 60 minutes to eat each meal and 30 minutes at each snack, even when the portions are small. Eating slowly will help prevent overeating and vomiting. We encourage you to read nutrition facts and the ingredients on food or drink labels. If sugar is listed in the first 3 ingredients, then do not eat or drink the product. Aim for less than 10 grams of sugar per serving. The lower the number, the better. Look for less than 5% daily value of fat. Avoid eating high-fat and high-sugar foods as they may cause a number of problems. First, they are typically high-calorie foods with little nutritional value. High-fat and high-sugar foods can also lead to the dumping syndrome. Refined sugars may affect insulin and glucose levels in your body, which can prevent weight loss and create feelings of hunger. Use low-fat cooking methods and avoid high-calorie sauces and condiments. Highly seasoned foods, spicy food, and food at extreme temperatures may also not be well tolerated after surgery. It is advised that you avoid chewing gum after surgery. Try sugarless mints instead to help maintain a fresh breath. When chewing gum, you can introduce air into your pouch, and that can lead to causing discomfort or pain or exacerbation of flatulence. It is very important to eat enough protein following bariatric surgery. Remember to eat the protein portion of your meal first. If you find it hard to meet the recommended amounts of protein for the day through food alone, then opt to add a protein powder to your hot cereal, stews, soups, etc., or have a protein shake or a protein bar to help meet your protein needs. The goal is to have 70 to 100 grams of protein per day. Please note that 1 ounce of protein-rich food contains 7 grams of protein. Maintaining food records after bariatric surgery is strongly encouraged. We would like you to think of your food journal as a guide to help you make decisions about what you eat. It is a great investigational tool to help you learn more about yourself, your habits, patterns, challenges, and successes. It can also help you identify your emotional and mindless eating behaviors. When it comes to discussions about fluid intake, the recommendation is that after surgery, you avoid drinking while eating. It is recommended to stop drinking 30 minutes before your meal and to wait 30 minutes after your meal to resume drinking. Drinking too soon before a meal will prevent you from being able to eat the nutritious food that you need. Drinking with a meal can turn the meal into a soupy consistency that can cause the pouch to empty too quickly and therefore affect your hunger or lead to the dumping syndrome. Drinking from straws after surgery is discouraged. Drinking from a straw can introduce air into your pouch and cause discomfort or pain. The goal is to consume 1.5 liters to 2 liters of non-caffeinated fluid per day. It is advisable to drink more fluids if you're very active, sweat excessively, or vomiting, or have diarrhea. It is important that you drink enough fluid to prevent dehydration. Dehydration is also the main cause of constipation after surgery. Ensure that you drink small sips of water throughout the day. Do not gulp down your fluids. Avoid carbonated beverages after surgery. The bubbles introduce air into your pouch and cause discomfort or pain. Avoid caffeine for 3 months after surgery. caffeine can irritate the pouch and increase your risk for ulcers and bleeding. After 3 months, you can drink beverages containing caffeine sparingly, 1 to 2 cups per day. Do not consume any alcohol in the first year after surgery. We recommend very little intake, if any, for the rest of your life. The absorption of alcohol changes after bariatric surgery because an enzyme in the stomach, which usually helps digest alcohol, is absent or greatly reduced. Alcohol may also be absorbed more quickly into the body after bariatric surgery. This may result in feeling intoxicated even with very small amounts of alcohol, and you may maintain higher levels for a longer period of time than others. This can lead to poor decision making. Do not drink and drive or operate heavy equipment after you've consumed alcohol, even in a very small portion. In Canada, driving at a blood alcohol concentration over 0.08 is a criminal offense. In some patients, alcohol use can increase and lead to alcohol dependence after bariatric surgery. Alcohol can increase your risk for ulcers and may also hinder vitamin B12 absorption.